So like you actually, what did you actually do? So that's the procedure code. That's referred to as the CPT code, current procedural terminology. And that's where you might have an office visit. So there's literally a procedure code for the office visit itself. And then there's a procedure code for the actual strep test. Okay. And let's just make it simple. Let's just leave it at that. It's important to know that in a pre-AI world, people literally needed to do the coding. And when it came to very complex coding for things like coronary artery bypass grafts, that heart bypass surgery in the hospital, you had this chart that was that thick with paper or like pages and pages long within the electronic medical record. And there was literally a person who was reading through that and translating those human created notes into those codes. And just know that that process is so complicated that even at major hospital systems with like tens of thousands of employees and like 8 to 10 hospitals within the system, the number of people within that hospital system who actually understood how to correctly code, you could count on one hand. The vast majority of the people who were doing the coding were actually not sufficiently trained on how to do the coding. They largely were guessing. I'm not trying to be pejorative, but just know that even if you did everything right with the prior authorization and you did everything right with the electronic submission, blah, 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 it could still get denied because the coding was done incorrectly.